welcome to Hashimoto's Unfiltered, real talk, real solutions. The podcast where we cut through the noise and get straight to the heart of living with Hashimoto's. My name is Dr. Ray Benedetto, your host, and I'm here to share my expertise, personal insights, and from time to time, conversations with incredible guests to help you take control of your health. Together, we'll explore actionable items, debunk myths, and navigate the complexities of your thyroid health. So whether you're newly diagnosed or a seasoned warrior, this is your space for unfiltered truth and real hope. Let's dive in. Okay, let's dive in today. As you can see, the topic of today's talk is about symptoms. It's a question I get a lot. So how can I have symptoms of hyperthyroidism and hypothyroidism, either fluctuating or at the same time, or I did have hypothyroid symptoms, now they're hyper, or vice versa, or they're telling me I have Graves and Hashimoto's. Like, how does this all work? All right. So let's kind of boil this down, and I want to try and simplify this for you guys and have this make sense. So we're going to kind of go through a couple of things today. We're going to go through nomenclature, like the terms that we use. We're going to go through like the mechanism behind autoimmune thyroid disease, like how it progresses. And then I'll answer, and then we'll touch on medications at the end as well, because they can cause some of the same symptoms. And people ask me all the time about that. We'll kind of tie that in with labs briefly, but I want to talk about like the mechanism and the progression and what's the deal here. Okay. Now, let's start with some nomenclature. Listen, we still use the terms Hashimoto's thyroiditis to describe autoimmune hypothyroidism, right? Underactive thyroid that's autoimmune. Autoimmune meaning that the immune system is attacking you. In this case, your immune system is attacking your thyroid, and it's making you go hypothyroid or underactive thyroid, right? So your labs are going to reflect that. Your symptoms are going to reflect that. Classically, we've called that Hashimoto's, right? Thyroiditis. Again, we still use these terms, but I want to clear this up for everybody. Autoimmune hyperthyroidism or overactive thyroid has always been known as Graves' disease. So we call it Graves' disease when we have autoimmune thyroid and it causes hyperthyroidism. Those classically, we've used those terms. Those terms, and you'll see them in the research and everyone's using them. I use them, like we still use them. They've been commonly used forever, right? Since the discovery of these conditions, because the poor Dr. Hashimoto in the 1920s discovered it. So that's why we named it after him. So we still use those terms. They've been around forever. They're not going anywhere. Here's the reality. There really is no difference between the two conditions. The underlying pathology, the underlying pathophysiology is the same. The immune system's attacking the person. In some people, it's going to make them go hyper. In some people, it's going to make them go hypo. That's more common, obviously, is the hypo. But people will have symptoms of both. And I get asked this question all the time. So that's why we're going to address it today. In the current nomenclature, as we sit here today, in 2025, right? This actually happened years ago with coding changes. So medical coding, right? So someone gets a diagnosis, it has a code. You guys have seen this in your files and stuff, right? They're numerical codes. Sometimes they're alphanumeric as well. So you get a diagnosis, right? And prior, so the current, it always changes, but the current diagnosis code system is called ICD-10, right? So when we changed from ICD-9 to ICD-10, they changed the diagnosis codes, right? Based on what current in the literature and all that kind of stuff. And in ICD-9 and prior, there were separate codes for Graves' disease and Hashimoto's. ICD-10 changes, those codes went away. They do not exist. They were lumped together into one code known as autoimmune thyroiditis, meaning an autoimmune thyroid problem that causes inflammation of the thyroid, and Graves and Hashimoto's are lumped under the same diagnosis because, again, circling back around, the pathophysiology, the pathology, the underlying cause, the autoimmune disease is the same in both. Just some people make them go hyper and some people make them go hypo, depending on what part of their physiology was affected. Okay, again, more commonly hypo, underactive. All right, so that's the deal with the names. We're still going to use Hashimoto's and Graves. They're not going anywhere, based primarily on someone's symptoms. Okay, if they're mostly hypo, it's going to be Hashimoto's. If they're mostly hyper, it's going to be Graves. But again, the question I get all the time is like, how can I have symptoms of both? I don't understand this. I've been diagnosed with both. Like it's all over the place, right? So let's keep it simple. There is no longer a medical diagnosis of Graves' disease or Hashimoto's. They don't exist. I can't diagnose somebody with those and put it in my chart because there's no code for it. The code is now autoimmune thyroiditis. Everyone gets that. If you have an autoimmune thyroid problem, it's autoimmune thyroiditis. Why do we get symptoms, though, of both? Here's the mechanism. So number one is nomenclature, the terms. Hope we got that straight. Look, there's still going to be a lot of confusion because we're still going to use all of them, the terms themselves. But that's the reality now. It's like it's autoimmune thyroiditis. The underlying causes are the same. We treat them the same. No, we treat them exactly the same. We treat them very similarly. So we don't use those terms anymore. Now, the mechanism, right? So here's what's happening, and here's why the symptoms end up being what they end up being. Okay, and this is why your labs end up looking like they do. So the immune system is attacking the thyroid, and it's damaging the tissue, right? Like, so it's attacking and it's damaged, like the thyroid tissue itself gets damaged. And the thyroid cells are what are known as follicular. They're like little pouches. They're like these little like balls. And like inside of those little pouches, those little balls are the hormones, the thyroid hormones, T4, T3, but primarily T4. And so what happens is when the immune system is on the attack, right? And it's a little more complicated than this, but let's keep this simple so everybody understands. When the immune system is on the attack, right? It's like going gangbusters and it's like bang, 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 banging away at your thyroid. What's going to happen is there's going to be tissue damage, right? The tissue is going to get damaged. It's going to get injured. And some of that thyroid hormone that's contained in the cells can get dumped out into the bloodstream, right? It's just like like it spills out into the bloodstream. So we get this giant rush of thyroid hormones, which can give someone very hyperthyroid symptoms. So the immune system's banging away in the thyroid, dumping all this hormone into the blood levels are going to go sky high. You're going to get all these hyperthyroid symptoms and be like, your levels are going to go crazy, right? Because the T4 and the T3, the T4 primarily, but the T4 and the T3 are going to go crazy high. The TSH is going to go crazy low. Someone's going to do your blood work. It's like, oh, it looks like you're hyperthyroid. Now, at that time, you might be. Doesn't mean you're going to stay like that. Now, what can happen then, obviously, is once that attack is over, say the immune system's like, bang, and then kind of like receded back into the shadows. Now, what's going to happen? Those levels are going to come back down again, and we're going to swing hypo. So that's why we can bounce back and forth to both, because it's like, whoop, 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 right? Attack, back off, attack, back off, attack, back off, right? So when we're on the attack, we can get hyperthyroid symptoms, especially early on in the progression of the condition, like especially when it's happening in the early stages. And then when it backs off, we go hypo. Depending on when you're getting your blood work done, your symptoms can be all over the place. Your blood work can be all over the place, right? Depending on where we're at in that continuum. Now, eventually, right? Usually, and this can be a week. This could be, not everyone even experiences that stuff. A lot of people just go hypo, right? They don't even experience the up and down. But eventually, if somebody does experience that, eventually there's going to be too much damage done to the thyroid and they're going to go hypo and they're going to stay there. Now, that could happen in a week, that could happen in a year, that could happen in a decade. There's no rhyme or reason. There's no way to predict that. There's no, but eventually if that's happening, someone's going to go, you're eventually going to go hypo because there's just too much damage done to the thyroid and it can't make enough hormones on its own anymore. Someone's going to be incredibly symptomatic. Usually they get diagnosed hypothyroidism, they get put on the meds, which is just thyroid hormone replacement because we're replacing the hormone that their thyroid can't make. So that's the deal with the back and forth of symptoms and blood work. Okay. It just depends on where you're at that time as far as the aggressiveness of the immune attacks or the non-aggressiveness, if you will. Right? So that's why people will swing back and forth. The immune system's on the attack, thyroid gets damaged, dumping out a bunch of hormones. You're going to have hyperthyroid symptoms. You're going to show hyperthyroid on a test. That backs off, or over time, that doesn't happen at all anymore. You're going to go hypo symptom-wise and lab-wise. So that's why things can look goofy. It's the nomenclature, which which aren't using anymore in medicine, but the terms are still used. Doctors who don't know any better and they're still using those terms or basing their diagnosis exclusively on someone's labs or someone's symptoms and not taking all of it into account. So I hope that makes sense. So that's the deal with symptoms swinging back and forth and labs swinging back and forth. Now, you could have that super severely happening and you go like really, really hyper and they're like, you have Graves' disease and it's really bad and it's really complicated. And that is a little bit of a different animal. But the question I get all the time is like, okay, why do I bounce back and forth? Why do I have symptoms back and forth? I thought I had Hashimoto's, but I'm getting hyperthyroid symptoms. I thought I had Graves' disease, but now I'm getting hypothyroid symptoms. I'm being told I have both. I'm showing signs of and testing of both, like all that stuff. That's the whole deal behind it. The nomenclature has changed. They're basically the same at this point. There is no Graves and Hashimoto's that I can diagnose somebody with. It's all one diagnosis, autoimmune thyroid. And that's the mechanism. The pathophysiology behind it is the attacks. When the immune system's on the attack, we can get a lot of thyroid hormone released. It jacks up the levels, suppresses TSH. It gives you a whole bunch of symptoms. And then when that stops, everything bottoms out and you go hypo. Again, eventually that's going to stay hypo when there's no telling. Okay. Obviously, medications can do this, right? If someone's being given thyroid hormone medication, Levo, Synthroid, whatever, this can be medically induced, right? If the medication is too high, it can cause hyperthyroidism. If the medication stays the same, but someone gets a really bad immune attack, now they can go hyper, even though the medication hasn't changed, because now we got a bunch of more hormone being dumped into the bloodstream because of the attacks and the medication. It's a fine line with meds as well. And again, the MD, the docs who are prescribing, the only thing they look at is your TSH, and they base their dosing, or maybe your hormones too, but they're only looking at your labs and they're basing your dosing on that. Not how you feel, not taking any of this pathology or pathophysiology or symptom or condition progression. They don't take any of that into account. It's robotic. It's your TSH and your levels look like this. I prescribe this. Your symptoms didn't get better. Sorry. Your labs are normal. I'm done. So yes, meds can play a role in here too, in both exacerbating and or helping. So I hope that kind of clears up for people. If you have any additional questions, let me know. But that's the deal. It's the naming. It's the names we use. It's the words we use, the nomenclature. This is why the symptoms can happen the way they do based on the progression and the pathophysiology of what's happening on a tissue and a cellular level. And then how medication kind of muddies the water sometimes. So I hope that was helpful. Hope that helped clear things up a little bit for everyone. If you have additional questions, let me know. But that's the deal. That's why you can have hyper and hypothyroid symptoms, or bounce back and forth, or have this, then that, or have this all the time or that all the time, and get diagnosed with all kinds of variations of stuff, and it gets very confusing. Okay. Bottom line is autoimmune thyroid is autoimmune thyroid. And we can mess around with the labs and the symptoms and the numbers and the medications all we want. The bottom line is we're not going to get it fixed until we address the underlying autoimmune problem. You guys hear me bang this drum over and over and over again when I give these talks. That's the bottom line. I want to thank you for tuning in to Hashimoto's Unfiltered, Real Talk, Real Solutions. Again, my name is Dr. Ray Benedetto, and I hope today's episode helped to give you the tools and the insights you need to take another step forward on your Hashimoto's journey. Don't forget to subscribe, leave a review, and share this episode if you think someone could benefit. You can also connect with me on Facebook at Dr. Ray Benedetto and on my website, drraybenedetto.com, for more resources and updates. Until next time, remember, you're not alone and real solutions are always within reach. Take care and be well.